The moment you never forget is the moment that somebody tells you that you have cancer. It's terrifying.
We look at the landscape of prostate cancer. It's really evolved over the last several years.
We've been able to, over the course of 10 years, continue to evolve, continue to improve our robotic procedure, where we can treat more complicated tumors.
We are looking at a cancer gene by gene, one step at a time. The key is in the cell.
The purpose of my research block the prostate cancer cells at the beginning of this metastasis process.
I think that the ability to think outside of the box and break the mold is truly what defines innovation. And that's what we strive to do here at Mount Sinai.
You have to show people what it is they want. That's what innovation is. Consider things that other people aren't thinking about. That's going to ultimately help the patient in the end.
The last thing anyone wants to hear at a doctor, if we only caught it sooner. I mean, who wants to hear that?
Our hope is we don't say a survivor of cancer. We say that we cured the cancer. We cured the disease. That's the hope for us.
We are committed to cure cancer. Failure is not an option.
I think the story of urology department is pursuit of excellence. Pursuit of excellence to help the patients. We have experts on kidney cancers. We have experts on transgender surgery. We have experts on pediatric urology. We have experts on kidney stones. We have experts on bladder cancer. And we have experts on the prostate cancers.
For over 10 years, under Dr. Ash Tewari's visionary leadership, the Urology Department at Mount Sinai has played a pivotal role in shaping and transforming the landscape of patient care.
Ash, he never gives up, and he will never stop working toward a cure of prostate cancer. He's driven in the best way possible.
Ash Tewari and his colleagues in the Department of Urology at Mount Sinai have built a powerhouse group in American medicine and is now a leading academic enterprise. A few years ago, the department had relatively small amounts of funding from the National Institutes of Health, but today, the department is in the top 10 of U.S. departments of urology with respect to NIH funding. What a spectacular level of achievement and success.
As a result of his vision and the hard work of his team, Mount Sinai has solidified its place as an innovator and as a world leader in the detection and the treatment of prostate cancer.
We are better today than we were last year. We are not at the peak, but we are getting close to the peak of beating many of these problems for humanity. And that's the story. We are trying to rewrite it, relearn it, improve upon, and make a dent on the different problems which humanity is facing.
What we have discovered is there is a gene called BRCA, which earlier discovered in breast cancer, but we recently found it is altered in prostate cancer too.
Through my work, I'm trying to understand how immunotherapy can benefit prostate cancer.
Using genomic approaches, my lab has been focused on really identifying the molecular characteristics of this highly aggressive, lethal form of prostate tumors.
What my lab is discovering and working on the how this BRCA mutation changes the cells from a benign to metastatic disease. What we are trying to understand, can we develop a particular therapy for the patient who carry BRCA2 mutation?
Our greatest discovery has been that we can reverse engineer the tumor microenvironment, trying to create it from an immune deficient to an immune rich microenvironment that can block the tumor growth and cancer progression.
We are able to define the molecular landscape as well as the cellular landscape of how the cells behave to really target and kill those cells before they reach their secondary site of metastasis.
Innovation means changing the status quo. Innovation means looking at the questions which no one has asked before. Innovation means looking for the answer at unknown places where no one has seen before. That's what I call innovation, and that's what we are doing.
Robotic surgery has been a game changer in terms of the treatment of prostate cancer. Robotic surgery takes minimally invasive surgery to a whole new level.
In the robotic surgery, we have developed methods of maximizing the cancer removal. We have developed nerve-sparing techniques which actually save more nerves. And we have developed methods in how to preserve the continence. All that is helping in a longer life expectancy and better quality of life.
I wanted to figure out a way to evolve this operation where the surgeon who's sitting at a console, controlling the arms and controlling the camera, can also do all of the other steps. And so that includes being able to control the clamps that stop the artery, to be able to control the ultrasound, to be able to control how we suture, how we clip.
The robot has a 10 times magnification, a 3D image, and you can go in with the camera, but close. So you can easily preserve the erectile function or sexual function nerves in male and females.
Some of the key benefits are less blood loss with the robotic procedure. We can do the robotic procedure with less pain, and in some cases without any narcotics at all.
From our review of our own data, we have definitely done better than national average in terms of readmission to the hospitals and complications. We recently did our cystectomy number 500 with this robotic procedure. The whole thing is done with the robot. And that's when you see the most gain for the patient if you can sort of avoid doing any type of incision.
One of the ways that we embody innovation is one of our treatment strategies in the form of focal therapy. Focal therapy is truly a targeted therapy. So instead of removing the entire prostate gland, we can just focally ablate the portion of prostate that harbors tumor and thereby preserving the continence and the erectile function that is very meaningful to the patient.
You should not die from prostate cancer. And I think I'm a product of that thinking after going through 2 bouts with prostate cancer.
No problem has been solved by one expert in silos. This symposium breaks those barriers. Everyone of a different mindset is gathered together for 4 days just to reflect, just to find, just to innovate, and just to make a dent on this cancer.
The thing that Dr. Tewari and his team gave me was confidence. They were confident, and so I was confident. And it made the process feel better. I kind of knew I wasn't going to die. And that's a gift.